I am Jagat Narula. I am the editor of JACC Imaging, and here I am in the CVN studios with three of my colleagues. Dr. Yukio Ozaki on my right, who is the Chief of Cardiology at Fujita University in Japan, Dr. Francesco Prati, Professor of Medicine in Rome, and Dr. Shiro Uemura from Nara University in Japan. All of us in this month of JACC Imaging have published a manuscript on the identification of so-called plaque erosion, and we are proposing that we should be able to avoid stent implantation in such cases. I would like to discuss with the three prominent OCT operators. So Dr. Ozaki, our association last year had also resulted in identifying the plaques in acute coronary syndromes which were associated with the ruptured fibrous caps versus those which are ruptured with the, which were associated with the intact fibrous cap. Yep. So this pathological substrates that we have defined as plaque rupture and plaque erosion, do you think that the time has come that we will be able to identify them as the clinical entities?
Yes. Actually, the ACS regions has either plaque ruptures and erosions. We previously investigated using OCT and angioscopy, and then in the studies, we defined ruptured fibrous cap as a plaque rupture, defined by ruptured fibrous cap. The other one is the intact fibrous cap. This means is the absence of the plaque ruptures, as well as the presence of the thrombus confirmed by OCT and angioscopy. In this population, at the end, it is we think it is reasonable to presume that intact fibrous cap may represent in a plaque erosion in a pathologically. So the Fibrous concept has recently been proposed by IConcepts in MGH.
Dr. Prati, would you please elaborate on this study? What exactly did you do and what the observations are?
We started with OCT patients who had an intact fibrous cap in presence of acute myocardial infarction, and then we saw that it was possible to treat with patient with simple thromboaspiration or with medical treatment without deploying a stent, and we had a very good clinical outcome in this patient. It was pretty much the same of the patient who had a stent implanted for the treatment of again plaque causing myocardial infarction with an intact fibrous cap. So the conclusion is that it is pretty safe, to treat this kind of lesion with interventional procedure without stenting.
Thank you. And Dr. Uemura, it seems like 1/4 of the population of the patients with acute coronary syndromes is the plaque erosions, or so-called acute coronary syndrome with the intact fibrous cap, as explained by Dr. Ozaki. Now, some of them, which are non-occlusive, we probably may be able to treat without stent implantation, as Dr. Prati just said. What about non-obstructive ruptured cases also? Do you think that there is a possibility that there may be some change in paradigm there too?
Yes. Thank you, Jagat. When we look at the ruptured plaque by OCT, we frequently observe the massive residual thrombs overlaying the ruptured site even after thrombus aspiration. And luminal stenosis is usually severe.
Yes,
so
sir.
one thing I could say is that the ruptured plaque with mild stenosis is not so common in emergency cath lab. However, if there is a plaque rupture with very mild stenosis, stent implantation may develop the complications such as severe malapposition of the stent plaque or distal embolism. So I think it is reasonable to say that conservative treatment may be applicable to such plaques.
Dr. Prati, any novel treatment options other than just not doing the stent implantation, like antithrombotics, newer antithrombotics, or the use of plasmin or something like that?
It's a tough question. There is no question. This is an open window. New possible strategy can be adapted. Just the fact that we can treat this lesion without deploy a stent is something very attractive. Then it is possible that the new antithrombotic drug, who knows, such as the bigatron, may have a role in the treatment of this patient, but it is obviously a big question mark that we have to address.
Great. And Dr. Ozaki, we are starting a registry. Would you like to appeal to people if we will be able to get some of these cases, and we would like others also to tell us as to whether this is a reasonable way of the management of plaque erosions?
Yeah, and actually, the first trial case derived from my institutions. I quite, let's say, expect the result of this registry, because this registry, let's say, in a certain sense, we can treat AMI patient without a stent. So this study, this registry, would convey us paradigm shift in a treatment of the patient of STEMI.
Thank you very much, and please look at this issue of JACC Imaging for this manuscript, which is accompanied by an excellent editorial by Dr. Braunwald. Thank you very much for watching CVN.